So I think that patients overwhelmingly have a very positive experience with telehealth, but definitely, as with anything in medicine, it's not a one size fits all. So I think that there needs to be more studies understanding patient perceptions on their virtual care and sort of how they want to incorporate that. And again, there may be different populations or individuals, whether it's just like comfort level of how they like to access their care, also feasibility from kind of an internet technology standpoint, to things that we will need to keep in kind of mind when we're setting up the schedule for our patients, because it's not going to be like a one prescription of like, this is how we do the visits for all of our MS patients, and that's what's going to work. So incorporating patients as a care partner, right, is super important. And so we do need to kind of understand that a little bit more. But definitely overwhelming patients are very pro the virtual visits, partly because, again, like I mentioned earlier on, a lot of what we do is around symptoms and discussions about kind of their activities of daily living and how things impact and what do they look like at the end of the day versus like at the beginning of the day, right? And stuff that I need them to tell me that story about their life. And so we can do that really well virtually, and sometimes we don't waste a lot of time with some perfunctory aspects of the in-person visit. And so patients really like that. They really like that, on their lunch break at work, if it's just kind of checking in, making sure we go over their labs, their MRI, we can do that like, quickly on their lunch break, and they didn't have to get time off of work. And so I would say that patients really like that. They clearly want it as kind of a mix, right? I don't have patients saying, I never want to come in and see you. But, they definitely say like, I'm not going back. I don't want to ever not do virtual. It's definitely an important aspect of my care now. I think that, we covered most of what I went over in the talk. I think that really from a future perspective, it's going to be the payer aspect and the licensure aspect will be a big thing. I believe CMS just kind of extended sort of that COVID coverage. So again, we're still a little bit in this kind of limbo area of what's kind of the final like legal decisions about things. So I think that in the next, 1 to 2 years, we're going to hopefully kind of settle out and sort of understand where we sit there. And that'll impact kind of, again, how we incorporate this long term. And then I think the other big aspect is going to be, which I didn't get into largely in the talk, but things around like the exam, like the neurologic exam or remote monitoring of our patients. I think that how we really kind of continue to capture objective data on our patients so that we can kind of monitor things closely in them. That's something that neurology in general has kind of been moving towards a little bit more, right? It's been very much an art with our exam, which is great, and you can pick up a lot of things, but how do we kind of really document that and monitor that over time? I think that's a thing that there's going to be more telehealth kind of solutions to that, that, will need to be vetted and really, scrutinized by the community from a research standpoint. But I think that that is where things in the long run are headed, and it also augment those telehealth visits, right? So it's about the conversation. It's about making sure you have kind of that access to your patient more consistently, but then it'll also kind of augment the fact that maybe we can't have our hands on that individual, but we do have really vetted ways of monitoring the neurologic function well.